name's Hannah. I work for Birmingham and Solihull ICB. I work in the Children and Young People's Continuing Care team. So yeah, we work with young people who have packages of care within Birmingham and Solihull. My role is very much working with families. So we work with families that have been initially referred in to see if they're eligible for continuing care. If they are, we kind of go through assessment and then get packages of care kind of set up. So working with families to work out what their needs are, what support they need, and then working out care providers to provide those support packages, and then reviewing those as time goes on and making sure they're still working, and putting in additional support if needs change and things like that. Recently I've been working with a young lady who was referred into our team because it was felt that she would benefit from some additional support. So she was attending school and had some hours through social care, but they felt that her health needs weren't quite being met fully. So we obviously have a professionals meeting with all the other professionals involved in her care to go through what those needs are, and then once we've got that kind of agreed, it then goes to panel to look at eligibility, and we're in the process now of getting kind of things set up for her, so getting that package of support. I work in a lovely team. We're quite a small team, so there's my manager, myself and 3 other nurses, and then our admin support lady who's lovely. So it's quite a small team, but it's really nice. We obviously work really well, really closely together. In terms of my role, it's a really nice work-life balance. There's no nights or weekends or on calls or things like that, so that makes it that's really beneficial in terms of balancing family life and children and things like that. So it's a sort of 9 to 5 role, no bank holidays, so that kind of helps. And also with working from home, so a lot of my role is working from home, and then there's also kind of going into the office one day kind of a week, and also doing some home visits as well, but there is some flexibility around that. So I find that flexibility really helps with that work-life balance. Before I did this job, I worked as a children's community nurse. So I've been qualified as a children's nurse for about 15 years now, and I've done all sorts of roles, so working in hospitals, working as a clinical nurse specialist, then I went into the community and worked as a children's community nurse, so kind of got a broad range of experience. I wasn't working exclusively with continuing care patients before this, but I was sort of aware of them. But yeah, this is my first role working kind of exclusively in continuing care, and my first role working for an ICB. I think my favourite part of the job is when you get to meet with families who have packages in place, and kind of you can hear firsthand the benefit and the impact that has made on the young person and their parents, and their wider family as well. And often these families, it's quite a difficult journey, and I think sometimes they can struggle for a while, and actually it's really lovely to hear when the package is in place and actually what a difference that makes and how grateful they are for that support.